In the United States, we have significant barriers to reducing healthcare costs. And I have to say, I don't see those problems magically disappearing if we made healthcare free for everyone. My good friend Dude Number One made an episode last week explaining how different our healthcare system is and how you can't really compare it to any other system. Go check that out on our page if you missed it. But today I wanted to zero in on some policies that increase our healthcare costs, and I also wanted to highlight how the American Medical Association and other similar groups contribute to that problem. The American Medical Association, or AMA, is what they call a trade union. But it's not a traditional union. The AMA is comprised of physicians all over the country, and their stated goals are creating a proper standard of care for patients and proper requirements for doctors. They put themselves in a position where they now create a lot of the rules for the medical industry, and they do a lot of this by lobbying for their interests. Right now, there is a physician shortage in the United States, and when you have a shortage of something, that absolutely affects the price. The shortage is due to how difficult it is to become a doctor here and the low number of medical schools we have for the demand. The AMA is largely responsible for creating the requirements and approving the new medical schools. They even helped make rules barring qualified doctors who earn their medical license in other countries from opening a practice in the United States. These types of rules help create a system where doctors pick their location and hours and the people have to just accept it. Accept it and pay whatever ridiculous price they write up for their services. We have some rural areas that have no access to doctors, and they have to drive significant distances to get any sort of care. I read an article from the AMA recently about their decision to stop nurse practitioners from opening their own practice. According to them, a nurse should always be supervised by a physician, and that's to protect the public from their perspective. But when people actually go to the doctor, the nurse is providing a vast majority of the care. You don't even see the doctor for most of the visit. If nurses were able to open their own practices and provide the same care, it would help reduce some of the costs. While the AMA isn't a traditional union, it does certainly function like one in some key ways, such as lobbying to create better wages and less working hours for doctors. And doctors deserve to make a lot of money, and they should have to go to school for a long time. I'm not saying they shouldn't, but I am saying we shouldn't have this many artificial pressures that are put in place on purpose to inflate prices and increase profits. An example in another industry would be pharmaceutical companies that lobby to keep versions of their drugs that are cheaper from being imported into the country. These are the types of policies that could be reversed right now and would make a huge difference. More people would have access to care, there would be more competition, wait times would be reduced. We would have a significantly better system right now if we made some small, meaningful changes. If you go and look at the material that the AMA is publishing right now, they agree that there's a physician shortage, but they don't take much credit for it. They are, however, willing to propose new solutions that are completely under their control that they assure us will completely solve the problem that they created. I would love to know what anybody else thinks about this in the comments. Love you, bye.